This is a case study about Michael, a 38-year-old male, and we do case studies and case reports to help you better understand what we treat, kind of how we treat it, and what the end result is, but really why we do it is for educational purposes, so you can understand a little bit more about the spine. Because when you understand the spine, you make better decisions. And when you make better decisions about your spine, you're more likely to solve your problems. Now, Michael came to see us because he'd had back pain for 5 years. And he had been getting treatment. And when he was getting his treatment, he was diagnosed by taking an x-ray. So the person took an x-ray, and they were able to identify that there were some changes going on inside the spine, but with the x-ray you can't identify what's happening to the disc. So Michael came to see us because he'd had treatment at the other clinic and he was a little better, but really his problem didn't go away. So he came to see us, and when he came to see us, we did an MRI. And with an MRI you can identify areas within the spine, most importantly the disc, because you can see the disc on an MRI and you can see where the discs are herniated. So with Michael, we identified that he had 2 herniated discs. And when we identified that he had these 2 herniated discs, we were able to put him into our treatment and specifically tailor and target the treatment for his herniated discs. And this is important because if you have a severe problem, but it hasn't been diagnosed, it's more difficult to treat it. He had a severe problem with his disc and it was undiagnosed, and the treatment didn't match the diagnosis. So we did the MRIs and we identified that the discs were herniated, and we had done a study in the past where we were able to identify that our treatment was very good for alleviating these herniated discs. And I just want to show you briefly what that looks like. One vertebrae on top of the other, the disc is in between, the nucleus is in the spinal canal. This is called a herniated disc. Okay, our treatment revealed over time, and this is the same patient, different MRIs, that the nucleus would go back to the inside of the disc. What we have the ability to do is we take pressure off the disc, and as we take the pressure off the disc, we allow for healing of the disc. So in Michael's case, he came in, we did the MRI, identified that he had the herniated discs and they were causing the sciatica. We formulated the treatment program for his problem, and his problem went away. After 12 visits, his pain had gone from a 4 to a 5 all the way down to a 0. So, it was hovering about a 4 or 5, and after 12 treatments, we got it down to a 0. And we were able to get him more functional, get him living a better life, but by the end of his care, he was functionally stable and out of pain. And the key to understanding what the situation is here is, if you don't have the proper diagnosis or the proper treatment for the diagnosis, very often the problem doesn't go away. A lot of our patients that come see us have had a lot of other treatments and not gotten better, because a lot of the other treatments don't treat the disc. Our program is specifically designed to treat the disc, and when we treat the disc pain goes away, but also the sciatica and all the other things that are associated with the pinching of the nerve, those go away as well. So if you have pain that's not going away, give us a call. We can identify what's going on. If you need an MRI, we can do an MRI and we can identify where your problem is, and then we can formulate the proper treatment for your problem. So give us a call or click on the button to make an appointment. We have another video coming up with it, which is Michael talking a little bit about his experience. Thank you. Have a good day.